Hi, in today's video I will talk about the connection between diabetes, heart disease and stroke. Welcome to Diabetes Free, the place where you get advice, motivation and inspiration for a happy and healthy life, of course, diabetes free. If you have diabetes, your risk of developing cardiovascular disease is more than double that of the general population, according to the American Heart Association. For people with type 2 diabetes, heart disease is the most common cause of death. There are a number of things you can do to lower your risk of heart disease. Understanding the connection between diabetes and heart disease is the first step toward prevention. The high glucose levels in the blood of people with diabetes can eventually damage blood vessels as well as the nerves that control them. Body tissues typically use sugar as an energy source. It's stored in the liver as a form of glycogen. If you have diabetes, sugar can stay in your bloodstream and leak out of the liver into your blood, with subsequent damage to your blood vessels and the nerves that control them. A blocked coronary artery can slow or stop blood from supplying oxygen and nutrients to your heart. The risk of heart disease increases the longer you have diabetes. Monitoring blood sugar is an important part of properly managing diabetes. Check levels with a self-monitoring device according to your doctor's instructions. Keep a journal of your levels and bring it to your next medical appointment so that you and your doctor can review it together. High blood pressure is an additional factor that can increase your risk of heart disease if you have diabetes. High blood pressure is one of the most common risk factors for heart disease among people with diabetes. It places strain on your heart and damages your blood vessels. This makes you more susceptible to a variety of complications including heart attack, stroke, kidney problems and vision issues. If you have both diabetes and high blood pressure, you're at least twice as likely to develop heart disease as people without diabetes. The simplest way to manage your blood pressure is to adopt a healthy diet, exercise regularly, and if needed, take medications as your doctor prescribed. Another issue that can lead to heart disease is high cholesterol. Poorly managed levels of blood fats like cholesterol and triglycerides are common in people with diabetes. They can also increase the risk of developing heart disease. Too much LDL or bad cholesterol and not enough HDL or good cholesterol may cause a buildup of fatty plaque in your blood vessels. This can create blockages and lead to having a heart attack or stroke. Although in many cases genetics influence cholesterol levels, you can still manage and improve your levels by making healthy lifestyle choices and maintaining a regular exercise routine. Taking care of your diabetes is important to help you take care of your heart. You can lower your chances of having a heart attack or stroke by taking the following steps to manage your diabetes to keep your heart and blood vessels healthy. You can start your journey with downloading my free guide with 7 tips to make your life easier as a diabetic. Click on the link in the description to download my free guide. If you want to watch more videos on how to reverse type 2 diabetes, make sure to subscribe to my channel. See you next time.